Right, I think there's enough of us on the call to get going now. So welcome to today's session. I'm so glad that you could join us today. What is our topic today? Today we're going to talk about the importance and the safety of correct lighting in both the CSSD and the operating room. This webinar series, or this webinar, the single webinar today, is brought to you by SAFMed. SAFMed is your solutions partner in both the CSSD and the operating room, and have been so for over the last 35 years. Thank you kindly, SAFMed, for sponsoring today's presentation. So what are we going to cover today? So in interest of bandwidth, etc., I'm going to turn my camera off in a second. If anybody else has any questions or comments or anything they'd like to raise during the presentation, please feel free to type in the chat box. I'll keep an eye on the chat box as we go along. As well as if you decided today is not the day for talking, please feel free, if you have any questions, again, queries or comments, to drop me an email at zana@safmed.co.za. So let's kick off and focus on the slides. What are we going to cover today? Today we're going to talk about a few things. The first thing, of course, we'll start with are various terms and definitions around light and lighting as a whole. Always important to understand definitions before we dive into detail. We'll touch briefly on the evolution of artificial light. And then, of course, we'll talk about lighting in the CSSD specifically. Then we'll move on to lighting in the operating room. And lastly, we'll talk about manufacturer's instructions for use. As normal, the importance of following the correct manufacturer's instructions for use, no matter what we're using, what product, what piece of equipment we're referring to. Being able to see in both the CSSD and the operating room is needless to say, is absolutely critical. And I'm very sure you realize that it's critical for the safety of the patient and the safety of all of us, or people who actually are working in the operating room or the CSSD environment. Let's learn some terms now. So these are the terms that we generally need to know or to understand about light and lighting and providing light in the operating room and the CSSD. Illumination is a term that we use for providing light for being able to see. Illuminance is a common term for quantifying how much light is available, because that's something we clearly need to understand, is how much light do we actually have. And our common unit to measure that luminance we refer to is lux. Lux stands for 1 lumen per square meter. Lux is an important term for us to remember going forward for today. Remember now, if there's less than 1 lux of light, we won't be able to see. Then it's just too dark to be able to see anything. So that's known as the threshold of seeing. In the olden days, we used to refer to foot candles, and some countries may still refer to foot candles, but in general, when it comes to light and lighting, we talk about a lux. So artificial lighting has evolved over the years. Of course, way back then in the caveman, somebody eventually figured out how to make a fire. We used fire. We used candles, we used oil, and we used gas to create light. After many injuries and, of course, many accidents, as you can imagine, with oil and gas lamps, there was, of course, the evolution of electricity, and followed soon thereafter as Thomas Edison developed the first practical incandescent lamp in 1879. What would happen is that electricity will flow through a filament, and then light is emitted. These are what a traditional bulb will look like. It is, of course, a bulb with gas inside of it and a tungsten filament. The electricity then flows into the tungsten filament. The filament heats up the gas. The gas then emits light, but it also emits a lot of heat. In around the 2000s, 2001, somewhere around there, LED lighting came into being. In LED lighting, LED stands for a light emitting diode. So going back to our school science, some of us were not at school when LEDs were brought onto the market. So what are LEDs? It's a semiconductor. It's a device that emits light when you flow current through it. Very important to understand the difference between an incandescent light and an LED light. Some of the features and aspects that are important to know is that an incandescent light gives off heat. Those of us that scrubbed for many years under incandescent theatre lights will know how hot it can get underneath one of those lights. Incandescent bulbs and lights use more electricity to be able to create the light. They've got a far shorter lifespan, and generally speaking, the light that's provided is going to be with quite a yellow tone or tinge to it. So over the years in the operating light room light environment, they used to apply various filters so that we could get clearer, more whiter light, because the natural light from those types of bulbs was in fact yellow. A light-emitting diode, an LED, gives off far less heat, far more comfortable to stand under it in the operating room. It uses less electricity to achieve the same amount of brightness. The bulb itself has got a far longer lifespan, approximately 40 times longer than that of an incandescent bulb, and the light as a whole tends to be far whiter. Again, we know that it's important to be able to see in the CSSD. I think we've all figured that out, but why? Of course, there are a multitude of hazards. If you're on the dirty side of the CSSD, there are biological hazards, there's pathogenic microorganisms, there's potential for injury with shops, and all of these horrible things around our dirty side of the CSSD. When we're inspecting and when we're packing instruments and sets, we need to be able to see what we're doing. In fact, when we're inspecting our instruments for cleanliness and functionality, we tend to use additional light and magnification. So we really need a lot of light when we're inspecting an instrument. In the storeroom, we're going to need to be able to read the labels to find or identify the packs and the sets that we're looking for. And of course, there is this huge issue of great potential, no matter where we are within the CSSD environment, and in fact in the operating room, is the potential to trip or fall over something. Some of our areas can be quite cluttered, some of our theatre corridors are cluttered, sometimes our CSSD itself can also be quite cluttered. All a risk for tripping and falling. So in 2014, the Department of Health released this government notice about the guidelines, the infrastructure norms and standards for CSSDs and operating rooms, parts of which that had been updated. And we're going to refer to both the theatre, we'll refer to the CSSD one, and we'll refer to the building and engineering version as well as we go through our presentation today. They state that lighting in the CSSD, here are their aspects. I picked out a few important aspects from this particular document. They say that natural lighting is highly desirable, especially in the work areas, and should be used wherever possible. So if there's a new build in a complex, they're encouraging the architects to please try to think of using natural light wherever possible. They say natural light is especially useful in areas such as the cleaning area and the packing area. But having said that, of course, direct sunlight in these workspaces must be avoided. Direct sunlight has an impact, for example, on packaging material and sterile barrier systems. They're not designed to be so exposed to direct sunlight. And heat, direct sunlight can also cause areas to heat up and then cool down quite quickly, resulting in condensation. So direct sunlight on the items themselves is not ideal. Don't forget about light fittings, because they're actually a potential source of all sorts of build-up, dust, dead insects, etc., etc. And so the guidelines talk about using sealed fittings that are generally going to be recessed. Normally, these are going to be fluorescent lighting. They also talk about the importance of having regular maintenance policies in place to maintain a clean environment around your lights. Have a look up at the lights next time you're in the CSSD carefully without injuring your eyes. But it's a good point. How many insects are floating around in our lights? An important point to bear in mind. Whenever I talk about safety, I go back to this Handbook of Occupational Health Hazards and Controls for staff in the CSSD, so specifically for staff in the CSSD, that was in fact released by the Canadian government, which was really quite a nice document. They talk to the fact that falling hazards are associated, of course, with slips, trips, and falls. If you're trying to prevent them, one would want to install a slip-resistant flooring, designing of stairwells that we don't fall down them, but also, most importantly, to ensure adequate lighting. Another hazard of our department and our areas that we work in is that we work 24 hours, and shift work is very important. And in that environment, lighting can be equally as important. And lighting also, we know, has a psychological effect. We wanted to be able to improve alertness and minimize drowsiness, and therefore appropriate lighting levels can be very important for this type of environment. So the Department of Health norms and standards for CSSD actually specify the minimum lux of the light in these particular areas in the CSSD environment. Remember, we said earlier that if there's less than 1 lux of light, we actually won't be able to see anything. So let's look at the minimum amount of light as per the DOH required in each zone. They talk about the general inspection area, that you need a minimum of 500 lux of light. That in the detailed inspection area, you need 1,000 lux of light. And often what we tend to do, we spoke about that earlier, is to use a magnifying glass with some form of additional lighting. In the wash areas, the requirement is at least 500 lux. In the general work areas, 200 lux. And in the storage areas, 200 lux. But they also tell us about the maximum amount of a light per zone, because too much light can also be a hazard. As you can see, they list that in the general areas a maximum of 1,000 lux, in the detailed inspection area a maximum of 2,000 lux. So be careful not to get light that's too bright. That can in fact be harmful to you. So there's our maximums, 1,000, 500 and 500 in the storage areas. In the operating room, there are 2 main types of lights. That, of course, is going to be number 1, the ambient room light, the light that's in that actual environment. Again, a tricky area. And then, of course, we need to talk about the surgical light itself. What do those Department of Health guidelines say about light in the operating room? They say that in the anesthesia area, we want a minimum of 500 lux and a maximum of 850. A minimum of 300 lux in the scrub area with a maximum of 520. In the recovery area, a minimum of 500, a maximum of 860. In the operating room, the ambient light is designed at 1,000 lux, and there is no maximum in the recommendation, and they talk about a minimum of 10,000 over the operating room table and looking into the cavity. 1,000 lux is going to provide a comfortable brightness to minimize the contrast. Because, of course, if you think about it, if the surgeon or whoever it is, of course, we also, the theatre staff, are standing scrubbed underneath that really, really bright light. And every time you look up or look out into the distance, there's going to be a huge glare, and that will tire your eyes if you're constantly going from this really bright light to a darker light. That's why the suggestion is that in the operating room, that the lux needs to be at 1,000. Before electricity and having the capacity of having light bulbs and being able to use that type of lighting when doing surgical procedures, back in the day they used natural light or candles. which of course had its own drawbacks, as one can imagine. So the rooms themselves were built with huge skylights, with white tile walls to be able to reflect the natural daylight, because that's all they had at the time. Then they started to use candles, and eventually, of course, once we got light bulbs and artificial lighting, surgical lighting was actually introduced. Looking at the image on the right, that was really quite an old version of an operating surgical light, and I'm very sure it would have been quite hot underneath that light. So artificial surgical lighting was first introduced in 1913. What features are there to surgical lights, or the light itself that's provided by a surgical light? Very importantly, the color temperature, the color rendering index, the pattern, shape and size, the uniformity of the light, the focal length of the light, and the depth of field. So those would be all important features that you'd want to look out for or to understand clearly if you were buying a new surgical light. Today, the focus is in fact on safety and safety of surgical light. So I'm not focusing on those features of a surgical light, and I do think that this should warrant itself a separate webinar on the features of a light and what it is we would look for if we are buying a new surgical light. The American College of Surgeons state that improper lighting and display orientation can have an adverse effect on the task performance, as well as cause eye strain and musculoskeletal fatigue. That makes good sense, and we covered this in our ergonomics presentation and webinar. They also go on to say that it's important to ensure that the open surgical field has high luminance and that we use 2 or more operating lights at different angles. The value add of doing that is, of course, to prevent shadowing. So it's quite useful to have more than one light at a different angle to prevent shadowing. We place the overhead lights between the surgeon and the assistant in most cases, and we want to avoid creating shadows from a single light source caused by the surgeon or, of course, the assistant's head. They remind us that for laparoscopic surgery, of course, is to dim the actual lights in the ambient lights of the operating room, because that'll reduce glare and contrast. I'm just going to check the chat to see if there's anything that I need to worry about. But I see it's all of us adding our AR bits to the recording. Okay, nothing to worry about in the chat box at the minute. How does surgical lighting help? This, I think, is quite logical for everybody who works in the operating room. It will enhance visibility and precision. It allows the surgeon to see the surgical field clearly. It helps us, the doctors, to identify critical anatomy, the various structures, the various blood vessels, and ultimately reducing the risk of error, reducing the risk of cutting the wrong thing or removing the wrong bits, or in fact leaving foreign objects behind. This gives us improved patient safety. It helps the surgeons detect bleeding or any other potential complications promptly, ensuring timely intervention. Fatigue is a very important aspect when it comes to lighting, and proper lighting minimizes the eye strain and the fatigue, especially during long procedures. It helps maintain focus and performance, of course, once again reducing the likelihood of mistakes. Accurate color rendering is a very important feature, and we spoke about it earlier as a feature in a light. We will refer to the color rendering index of a light itself. Again, something we could follow up in another webinar. Modern surgical lights, especially the LED lights, have got excellent color rendering, so that it allows the surgeons to be able to distinguish between the different tissues and the different fluids quite accurately. Makes it a little bit easier for you to see venous blood versus that coming out of an artery, which of course has a different color to it. And if we get the right color rendering index, we'll be able to see whether we've just hit a vein or an artery. In this surgical journal publication, titled The Current State of Surgical Lighting, the authors highlight a few very important points about surgical lighting. They talk to the fact that there are three critical components and that they're essential to optimize operating room light or operating room illumination. And they talk about centering on the surgeon's immediate field, so being able to center the light in the right place, which means you're looking for something that's also movable. Being able to illuminate either a wide or a narrow field, and doing so with a high intensity of light. And that we're looking for light that can also penetrate into a cavity or look, for example, under a flap. Those are the three most important concepts around surgical lights. And as you can imagine, manufacturers have worked on these for a number of years. But having said that, they also allude to the fact that having a bright light is not necessarily always better. Brighter is not always better. Because a consistently applied light source, which is too intense, in fact, can cause glare. It washes out some of the details and it mitigates contrast. And we need the contrast to be able to see the different tissues, the different layers, the different structures. The photoreceptors in our eyes are highly sensitive to the stimuli, and that can be affected depending on the duration, the intensity, the wavelength, and the intermittence of the light that we're dealing with. And for that reason, moderate, buildable light is what's optimal for surgeons for proper visualization. So we're looking for light where we can add to it. So we can start with one light at a particular intensity, bring in a second light if needed, a third light, depending, of course, on where you're operating and what part of the body you're working with. If we need to get down deep into a cavity, we might need to be able to focus the light more intensely. We want to be able to increase the brightness of the light at that point, but we don't want full bright light all of the time. That's not going to work the best to be able to see properly. And full bright light has other intense bright light like that, has a huge risk to it. And in fact, we're going to look at two case reports now of patients that sustained burn wounds from their surgical lights. In this particular case, a patient presented with an old pelvic injury with a non-union, and that pelvis then needed to be plated and screwed. If you look at the image on the left over there, that was all the X-ray of all the plates and screws post-surgery. The image on the right was a clinical picture just depicting the normal skin while they were doing the incision. You can see all of the retraction that was involved, a point that they thought was very important to a contributing factor to the potential of this injury. To note, the procedure was quite complex and it took them over 4 hours to perform. The day after surgery, the patient presented with a large blister over the inguinal region, just above the suture line, and that blister was accidentally ruptured while they were busy doing the dressing. They found second-degree burns with deep partial thickness burn in the center and a superficial partial thickness burn more towards the periphery. This wound needed to be debrided and it also needed skin grafting. The only plausible reason that the surgeons and the authors could come up with in terms of this was in fact the decreased distance of the operating light from the surgical site, meaning that they had to bring that light in a hell of a lot closer than they would normally. Of course, the normal distance we would work with is 1 meter. They're saying that the cumulative effect of everything, the site of the operation, because that's quite a tender area, the prolonged retraction, and the intensified light exposure is what caused the patient's burn. So in this vascular-based procedure, they had a male patient that presented with lower limb ischemia due to occlusion. So it's a patient who had peripheral vascular disease, important to bear that in mind. The patient needed emergency bilateral groin expiration and obviously a thrombectomy. During the operation, they did actually notice that the suprapubic area was quite hot to the touch. And then 24 hours post-op, they actually then noticed the burn. So in both instances, the burns were not there immediately, but they were picked up 24 hours post-op. Both instances we were working in the inguinal region, so obviously quite a sensitive region. Initially, this particular burn was treated with dressings, and eventually it got worse and worse and worse. It needed some debridement, some excision, and a skin graft at the end of the day. It couldn't have been pleasant to be the patient involved in this, I must say. So to understand this scenario, in fact, one of the surgeons volunteered as a human guinea pig, and they lay him down under one of these lights for an hour in exactly the same position, exposed his inguinal area, and then measured the temperature of his skin an hour later, and the temperature had risen quite significantly. In this publication, they talk about some other important factors around lighting, and they remind us about the current international standard recommendation of a minimum of 1,000 lux of light in the operating theatre environment itself, which of course is in line with the South African standards. So that was quite nice to see. They talk about brighter light being required within the surgical field. Of course, we know that. And that the recommended range for surgical lighting is between 40,000 and 160,000 lux. So remember, when you're dealing with the light, one individual light may be giving off 90,000 lux, the other one 90,000 lux, or the light, or one single light maybe even can go up to a maximum of 160,000 lux. But remember, together combined, we don't want more than 160,000 lux at one time, at one point. The recommended distance between the operating light and the operative field remains 1 meter. So that's what the guidelines are working with when you're actually designing a light. And in both of these instances, there was nothing wrong with the surgical lights. They were not faulty. It was just how the light was used. So combining two light heads or a multitude of lights together shone into one particular area for an extended period of time has great risk to it, and the patient has the potential to develop a burn. So some of you may be familiar with the ECRI Institute, and ECRI was originally founded under the name of Emergency Care Research Institute. It's in fact an American independent healthcare research non-profit organization. ECRI release a whole bunch of safety alerts and annual reports, which are quite interesting to read yearly. Often we find flexible endoscopes in there and all sorts of hazards that they refer to in our operating rooms and our CSSD environments. In their 2021 hazard report, report number H0724, they specifically mention the risk of patient burns from overlapping light fields at high intensities. Overlapping light fields, of course, is when multiple surgical lights are focused on the same area, and the combined intensity of the light reaches those levels that exceed safe limits for tissues, potentially causing damage and causing burns. So what can we do to mitigate the light or these potential risks? And this is in the ECRI guideline. It talks to the fact of the importance of avoiding overlapping of light. So wherever possible, surgeons should avoid crossing or focusing multiple light heads on exactly the same area, on exactly the same spot, and limiting that exposure time. So if we do need to overlap the light to see deeply, to get into a cavity, try limit that time so that it's not too long. And then maintain the appropriate light intensity. So ensuring that you have the right amount of light that you can see properly, but that it's not excessively high. So it always makes sense to start low, start with the lower light, and then increase the intensity as you go along. We've learned already now about the distance being 1 meter. If you're reducing the distance between the patient and the light head to less than 1 meter, you're increasing the risk. We know that there's the risk of thermal injury is increased for certain patients, including neonates, geriatric patients, patients taking certain medications, and these sensitive parts of the body as well. And we now know that the inguinal region, based on these two case reports, is definitely an area that is quite sensitive to light. So I'm going to use this manufacturer's user manual, a few points out of the user manual as a guideline, as an example of things that we should think about when following the manufacturer's instructions for use. Because remember, in these incidences that we've seen now, it wasn't the surgical light that was at fault, it was how we used it. I think we may have become a little bit lax now because we've become very used to LEDs, and of course LEDs are really and truly not as hot, and maybe for that reason we've become a little bit more lax. Always important, it'll say familiarize yourself with the settings and how to use the product before you use the product, so make sure you've had very good in-service training. It states quite clearly that if you are doing surgery to a patient's face and the eyes are unprotected, that there's a good chance that you could damage the patient's eyes. Therefore, the eyes must be closed or protected during surgical procedures. Thankfully, we all do know that. During the procedure, also quite obvious in this instructions for use though, but I guess we have to be clear about this. They remind you that sterile personnel should not interact or touch the handle unless you have got a sterile handle attached. And then importantly here, if high intensity is used, i.e. a combination of multiple light heads, there's a risk of excessive radiant energy in the surgical field and can potentially dry out tissues and cause superficial burns. They also go on to remind us not to stare directly into the light, and that these lights are not intended to illuminate upwards, and don't flip a light, especially when it's on. I don't know why, but I used to like flipping the lights up to create this lovely ambiance under certain circumstances, and he recently learned that I shouldn't do that. So please be cautious about flipping your lights up. Really not ideal for the surgical light. So our technical department were chatting to me a little bit about maintenance and what they would do when they're servicing and managing and looking and assessing and installing a surgical light. The wall control itself is important, that it's functioning properly, that you follow the instructions for use. Even one of the manuals was saying don't store things on top of the wall control, especially if somebody brought in some liquid of some sort, don't store it on top of the wall control. The light head itself, managing it, looking after it. I mean, there's so many logical things about not bashing, not banging, be cautious with how you bring the light into the field. There's also the issue around surgical field contamination on the light head itself, so not banging the two lights together and making sure that the head is correct, both anatomically and working correctly. Very importantly will be that they measure the lux of the light intensity. So they will place the light 1 meter above the table while they're doing the servicing and measure the lux to make sure that the lux is sufficient, as in it said it delivers whatever 90,000 lux, it should be 90,000, that you're not being shortchanged, but on the other hand that it's not exceeding what it's supposed to exceed. And that of course is a huge safety implication. Also, they'll check the yoke and the spring arms to make sure that we prevent that the brakes are good, that there's no drift, etc. Around the light. Also making sure that it's correctly anchored to the suspension plate. That's of course in the roof, ensuring the light doesn't fall on your head. And then of course the importance of service and maintenance as instructed, as is in the manufacturer's instructions for use, depending on the make and the model of the particular lamp or surgical light that you're using. So in essence, if we go back now and think about what all we covered today, so we've spoken about incandescent lights, LED lights, and measuring light intensity and terminology, light illuminance, and lux, so basics behind it. Lux, the minimum and the maximum lux lighting in the CSSD and the operating room environment. Remember, we're looking at 500 lux in the general areas, in most areas, 1,000 lux for closely looking or inspecting your instruments, 1,000 lux for the ambient light in the operating room, And we don't want it to be less than that. Otherwise, the contrast is problematic for the surgeon and for you every time you look up and away from underneath the operating light. That the recommended lux for surgical lights themselves is between 40,000 to 160 lux. So remember, if you're overlapping two lights together, be careful that you're not exceeding 160. You can drop the intensity of the one down to, it may be a 90 and you drop it down to 50 and you bring in a 90 together, that at the end of the day, you're not overdoing it, because we don't want to burn our patients. We know of 2 case reports now that were reported in recent times of burns from surgical lights. And please, those lights, even though they feel a lot less hot than the older incandescent lights used to, or the halogens that we used to work under, they still can cause injury and we can still burn our patients. And then following the manufacturer's instructions for you. So making sure that on installation you get all the right training, that you know correctly how to use the lights, but remember at the end of the day, do not overlap them. Now, we haven't gone into any details on the important features that we would look out for us in a surgical light, what actual color rendering indexes and color temperature. We haven't really covered, which we haven't at all covered, the importance of the design of the light head and whether or not it's going to impede the laminar flow, and how manufacturers test the turbulence of air when they're designing their light heads. We haven't covered the importance of cleaning the lights, the surgical lights, or the role that a light could play in the transmission of disease, because there are a few published papers on that already. So having said that, I think it's certainly something that we would like to create another webinar about. If you're in agreement, let me know, let us know in the chat, or alternatively send me an email about that concept. So thank you very much for joining us on this cold and slightly miserable day. I hope the weather is not bad in all areas of the country, but thank you for joining us. Hopefully you'll keep warm, not under your surgical light, please, and not overlapping so that you don't burn your head. Thank you so much. Enjoy the rest of your day.